This is the first of a series of Animal Health Ireland videos on dairy cow lameness. Now, dairy cow lameness is a really important problem that we see in Irish dairy herds as it is in herds worldwide. And it has a lot of impacts on welfare and productivity in herds. It's a significant problem in the dairy sector. Most research has shown that as many as 10% of cows can be lame in herds at any one time, and in some herds we've all seen up to a third of cows or sometimes 50% of cows lame. Now, lameness is really important from the point of view of welfare. It can cause a lot of pain and it can affect how a cow will use itself, how a cow will eat, it'll affect feed intake, and all those things will have effects then on productivity. Now, generally speaking, when we talk about dairy cow lameness, we divide it into two categories: non-infectious and infectious. With non-infectious, we're talking about lesions on the sole, not really associated with bacteria. Things like sole bruising, sole ulcers, white line disease and abscesses. So they're one particular type of lameness. On the other side then we have issues around infectious lameness, and those are associated with bacteria such as Mortellaris, digital dermatitis, such as issues with foot rot, such as issues there with slurry heel. When we go back to the non-infectious lameness, those ones where it's sole lesions, that's really associated quite a lot with the environment. Rough concrete, yards and roadways which would have a lot of loose stones and be rough and hard on cows' feet. Can also be associated with body condition score loss and hormonal changes around calving, and particularly with the loss of fat pad. When cows lose body condition and they lose that fat in the foot, that also causes quite a lot of lameness in that way. On the other side then, with the infectious lameness and the build-up of bacteria, that really occurs in slurry. So that one really, the infectious lameness, you're talking about environments where there's a lot of slurry build-up, either at this time of the year on roadways when cows are going in and out, or in the winter time, particularly inside in the housing. So those risk factors are very important and can predispose then cows to a lot of lameness. Firstly, lameness though is an animal welfare issue, and it causes a lot of pain to cows. It'll affect a cow's ability to walk, its gait, how it stands even, and how a cow walks off. And you'll often see a cow walking off with an arch in her back. Even if you don't see which leg it is, that cow is lame. And those effects then on the cows, how cow walks, how she eats, will have secondary effects then on mastitis and on fertility and a risk of that cow being culled. So huge impacts on the productivity of a cow. When it comes to fertility, it's primarily the effects on submission and seeing a cow in heat, because lameness affects how a cow will express her heat, how she'll express her estrus. Hard to pick up a cow who basically doesn't want to stand for heat, doesn't want another cow to jump on her. That affects the ability then as a farmer to pick her up and to serve her, and that has a big effect on fertility. Also, because these cows don't eat much, they go into what's known as negative energy balance. And that can affect in the quality of the oocytes, and that affects conception rates. So overall, a huge effect on fertility in lame cows. The effects on feed intake then will have big effects, of course, on milk yield and on milk solids, on low proteins, leading to high fat to protein ratio, and that will affect the bottom line in dairy herds, which is really important. The other big issue it has then is the effect on culling, and the risk on culling is huge when it comes to lameness. And in that way, it affects the environment hugely, because we're losing cows. Cows are not surviving as long as they should be. That then leads to the fact that they have problems because of culling in terms of producing what they could have done during their lifetime. That has effects on the environment. That has effects on sustainability in dairy herds. Lameness as well, especially infectious lameness, leads to the use of a lot of antibiotics, and we're in a time period now where antimicrobial resistance is hugely problematic, and we need to be reducing the use of antimicrobials on farm, and by tackling lameness, that will help with that challenge hugely. So lameness has big impacts in all those ways, and in all those ways then it also has big impacts on economics and the cost of disease on dairy herds. When it comes to economics and the cost in dairy herds, pretty much what you're talking about really is about 129 million per year in Irish dairy herds. That is a huge sum. And the cost at the herd level, it's associated with treatments, it's associated with poor fertility, it's associated with reduced milk yield and culling. And In a standard Irish dairy herd with just a 10% prevalence of lameness, the annual cost can be as high as €8,570 or $85.70 per cow, and that would be quite common. We have some herds in the country where a third of cows could be lame and they're suffering costs of multiples of that, up to 20,000–30,000 a year in losses due to lameness. So because of that, then the early detection and treatment is absolutely very, very important, and to identify and monitor lameness on farm. The monitoring of lameness can be done via mobility scoring. So the UK AHDB mobility scoring system, this is a very, very practical way of identifying a lame cow and then also monitoring and recording how those lame cows go during the year. And in further videos in this session, we will go through mobility scoring in some detail. It is very, very possible to control lameness very well in Ireland. A recent Teagasc study has shown that the top 20% of Irish herds had a lameness prevalence as low as 5%, which is absolutely brilliant and meeting all world targets. So it is very, very possible to do. So record keeping is really, really important as part of this. There's also a genetic influence as well, a genetic predisposition to lameness, and it is important to select bulls that have a favourable health subindex in terms of tackling this issue of an increased risk of lameness in herds. So cows are genetically poor on health traits. Those cows have a 44% higher prevalence of lameness than those cows that have good genetics for lameness or good health traits. So lameness cases can be recorded directly on the ICBF website, and that will allow you as farmers to monitor the prevalence of lameness in your herd. Alternatively, farmers can record lameness on ICBF through text message. For example, say if you had a cow 127 in your herd who was lame, you would text the message lame 127 to 089 45 77 663. 089 45 77 663, and that will be uploaded and recorded on the ICBF website then for you. And it's important then if you can record any treatments as well. That's very, very important, and that'll go up on your ICBF, but also you can record them on the medicines register in line with Department of Agriculture requirements as well. Controlling and preventing non-infectious lameness and infectious lameness, then they're very, very important, and it's important to differentiate between those two categories. With non-infectious lameness, we said the risk factors were environment, body condition score, hoof trimming, and associated nutritional factors. And so what a farmer could do is they could look at those things and think about the design and maintenance of the yards, and walkways in particular are very, very important. Thinking about cow comfort from the point of view of rubber on slats, rubber around the parlour, rubber near feed spaces, and avoiding tight turns. That's very, very good for cow comfort. In the winter period when cows are housed, cubicle numbers, very, very important. With a good quality lying surface such as a good quality mat or a mattress, or even maybe sand if it's suitable for the farm. Optimal nutrition then to minimise this body condition score loss post-calving is really important, and also routine foot trimming. When it comes to the infectious lameness then, as we mentioned, that's all about hygiene and preventing the build-up of slurry. Slurry in the housing, slurry in the roadways. So what a farmer could do there would be to look at that and also think about how do you keep cows' feet clean. And one way to keep cows' feet clean is to use regular foot bathing, using water baths, and also foot bathing using appropriate disinfectants. Regular foot bathing, management of roadways, housing and yards to prevent the build-up of slurry. And also then if stock are being purchased into a farm, so it's always ideal to have a closed herd, but where stock are being purchased in, to use prophylactic foot bathing of purchased animals just in case they would bring in mortularis, digital dermatitis or some other infectious lameness. And then routine foot trimming as well. So that's an introduction to dairy cow lameness, and we hope you'll work with us to meet this challenge of dairy cow lameness in Irish dairy herds.